stroke, we call it brain attack. We call it brain attack. Now, what is the number one cause of stroke? Hypertension. So stroke is called brain attack. Who's at risk to have stroke? Black people, African American. Now, there is two types of stroke. Two types of stroke. Don't talk. Don't talk. Whoever said three, don't talk. You could have read it if you knew it. Okay. Ischemia and bleeding, which is called hemorrhaging. Now, Mommy, you're taping, right? Can I use you or no? Yeah, sit right here. Okay? So, two types of stroke. Now, the person that yelled three, there is something called cerebral vascular accident. It is, well, we got to be careful to call it a major stroke because it's not. It's a warning. It's a warning. It's a warning that you may go here or you may go here. It's a warning. You will see some paresthesis here, but very, very mild. Very, very mild. The major stroke is ischemia and hemorrhage, Créole, boule sang, clot, bleeding, patient abaissant dans tête, bleeding in the brain, clot preventing oxygen from flowing, bleeding preventing oxygen from flowing. Now, this causes ICD. This causes ICD. Both lack of oxygen cause pressure to increase. Now, when you have a stroke, she comes to the ER, and we will say she had a stroke, ischemia stroke. So we're going to say the stroke is here, right here. This side that the stroke is in. Yes. You can't. We'll move her close, Mommy. Come over here. You can't see. I want to do. Tell me is that okay? Or if you put in the middle, go in the middle.
Right where the socket is.
Right here. Is that good?
Yeah.
Okay. Now, so I'm going to change her stroke. Everybody can see, right? Yeah. So we're going to say the stroke is here. Right here. She had the stroke here. We'll say ischemia. That means lack of oxygen flowing in the brain. Now, the stroke is here. She is blind. She's not blind here, excuse me. She can see. She can chew. All of this is good. Where the problem is here. She's blind. She can't chew. All of this weak. But the stroke is here. Wherever the stroke is, the patient can see. Again, the stroke is here. The stroke is here. She can see. She can eat. All of this good. It is this side that is bad. So we're going to say this is the stroke side, and we're going to say this is the non-stroke side. In my class, don't use affected and non-affected. You're going to say stroke and non-stroke side. Any questions? So we're going to say stroke, right? Non-stroke side. You good, right? Now, NCLEX asks you which side of the room you, the nurse, going to come in. Again, this is the stroke side. This is the non-stroke side. All of this side is weak. Although the stroke is here, she can see here. So, since she can see here, I'm going to walk from here to here. Any question? We cool. Now, so I'm going to come in here, the stroke side, and introduce myself because this is the side she can see me. She can see, she can eat, she can So, if I'm going to feed her, I'm going to put the food here. Yeah, got it. Yes. The stroke side. Now, when you come in the ER for having a stroke, all we see is one side paralyzed. We don't know if she have this or this. All we see is, so the first thing the doctor order is a CT. CT of the brain to see if the stroke is boulson or sankaye nantet. English. If the doctors, the purpose of the CT to see if it's a clot or it's bleeding, because if she's bleeding in the brain and I come give her thrombolytic, I just
kill her.
All right. Where did we learn thrombolytic? Med-surg, cardio, streptokinase, actoplase, all the ones in with ACE. Any question? So the doctor ordered a CT. And we realized the patient got ischemia. NCLEX going to ask you, how do you position? That is fundamental positioning. You put them flat. For ischemia. Then NCLEX asks you about the drug. Anytime you give it streptokinase, actoplase, the pace, you got to ask a few questions. Probably not her, but the family. How long was she found like that? Because anytime a patient found 4 hours without lack of oxygen, you cannot give her the pace. Anytime the patient got kidney problem, you cannot give her the pace. Anytime a patient have uncontrolled hypertension, you cannot give her pace. This was found on page 709, thrombolytic, right? The little box. Any question? Now, so I taught you that so far, one type of stroke ischemia, I told you how to position the patient. I told you where I'm going to come in the room because this is where she can see. Now, another activity we do for stroke patient, physical therapy. Because when she had the stroke here, this side is weak. In her eyes, she thinks this side is dead. So this is the one they call neglect syndrome. So I'm going to move here, not because here work. I'm going to come here to help her what?
Exercise.
Exercise so she can use what?
This side.
She can use this side because if you don't use it, you will lose it. It will become atrophy. Any question? Now, right? NCLEX asks you how to walk with a stroke patient. Now, where's her strong side? The stroke side. So she's going to stand with the strong side. So they ask you a few questions. They ask you how the nurse walk with stroke patient. They ask you how stroke patient walk with cane. They ask you how to get a stroke patient out of bed. They ask you, put in order how to walk with a patient. So she has stroke, right? This is the stroke, this is the weak. So where am I, common sense, I'm the nurse. Where am I going to stand? Non-stroke side, because that's the weak side. Guys, the stroke side is strong. She can stand up by herself on the strong side. It's the weak side I need to stand because I need to be her what? Support. So, I'm walking with her. I'm going to do what? I'm going to help her. But she needs to try to get up with the good one. Stroke side by herself. So you're going to say, Cowell, try to get up because this side is good. See, they're not babies. You don't do everything for them. So you will hold that and say, okay, we're going to get up. Now remember, stop. If she have a good side, you lift this first. Avancer. Non, avancer comme ça. Et puis lever à bas ça. Bon. Et puis moi-même, you see that? Now, you see that? Now, NCLEX asks you how you're going to walk with a stroke patient. Okay. She always going to move the good, strong one first. So she's going to move this one. Et puis moi-même, the nurse, I'm going to move this one. Right? And she's going to move this one, and I'm going to move this one. We walking. That is how you walk with a stroke patient. Sit down. Now, NCLEX going to ask you how a stroke patient walk with a cane. Right? Now, when she walk with the cane, she got to walk by herself. The cane is me, the nurse. She got to walk by herself. So, ready? The stroke is here, and the weak is here. What side do you put the cane, people? The stroke side. So, I'm her. I'm her now. This my stroke side. This my weak side, right? Cane. Good leg. Bad leg. cane, good leg, bad leg. You see, she take the leg and even reveal it wrong. Yeah. Because it's no good. Cane, good leg, bad leg. Any question? That's the patient walking. We cool? So, how the nurse walk with a stroke patient, how the stroke patient walk with a cane. Now, before I get here, the way NCLEX gives you the question, if I say the patient have a stroke on the left, you already know where's the weakness. They don't put that. They don't put the stroke. They put the weakness. There you go. The patient got right side hemiparesis. Boom. Where's the stroke? Where you going to feed the patient? Left side. Who said right? Hemiparesis on the right. That's the weakness. Now, where's the stroke? Left. Where are you going to feed the patient? Left. That's how they get you. They don't put stroke. They put the weakness. You got it? So if I tell you the weakness is on the right, that means the stroke is on the left. Where can the patient chew? On the left. Where I'm going to put the food? Which eye can see? The left. Where I'm going to enter the room? Okay. That's what they give you. Now, then they're going to ask you, who could feed her? You put CNA. Oh, RN. Why? There's an assessment need to be done. Yes. Of course, speech therapy. They need dietitian, nutritionist. They need speech therapy, physical therapy, and psychiatrists. Because they might commit suicide. Because anytime you have a stroke, you ain't never the same person.
But they have OT also?
OT, now, if this side, see, if OT make new tools for you, OT is good for arthritis. The hand turn. So I need to make a spoon so you can hold. OT. OT have nothing to do with strength.
But don't they teach them to trust themselves on the weak
No,
side?
OT. It's physical therapists that help them with strength. If you lose an arm, and I have to make some special equipment for you to use, make OT. Right? Prosthesis, OT. Special shoes, OT. Physical therapy, stroke, PT. Problem speaking. Speech, bon. Manger, what food? Thickening, not soft diet. Boy. Do you know puree? You know if you give her scrambled egg, she gonna choke. You know if you give her yogurt, she gonna choke. You gotta thicken. You gotta get the scrambled eggs. Put a little water in it. Put the thickening. Make it thick. You give her. No soft. Students think these patients, you give soft diet. Boy, her problem is not chewing. Her problem is swallowing. If I don't have teeth, you give me scrambled egg, mashed potato. You give her mashed potato, she gon' choke. Yes.
Sometimes it's a mechanical stuff.
Hey, anytime you see mechanical in the question, that means pureed. Depiti mechanical. Konen get thickener ladder. Thickener. That's why they will not, that's why they'll put a stroke patient get mechanical soft. Yes, you know what they're saying? Thickener. Anytime it's mechanical in it, it's the thickening. Yes. Any question? We cool? Now, you remember yesterday we did Bell palsy? And I told you weakness is here. Where I'm going to put the food? On the other side. Stroke. Stroke is here. Where's the weakness? Stroke is the weakness here. Where I'm going to feed them. Be careful with that on NCLEX. Students, again, let me see, I was talking and boop. Look, you remember yesterday I did Bell palsy. I said weakness is here. Where I'm going to put the food. We cool. Don't say stroke, because there ain't no stroke. Say non-weakness. Now, she got a stroke here. Where's the weakness? Where I'm going to feed her. Bingo. Be careful with Bell palsy. Bell palsy is not a stroke. Any question? We cool? All right. So this is, yes, this is where I got one more thing, and I'm going to stop here because I want to keep the morning and the night class together. Yes. I'm going to talk about that. I said I'm going to do that, and then I'm going to stop, right? Okay? Now, NCLEX asks you how to walk with different patients and how to get them out of bed. Now, before we go do the out of bed stroke patient, we're going to do that last. Let's do how to walk with her being blind. She's blind, you're going to walk with her. We learned that in med-surg, eye and ear. Now, mommy, you got to stand up. When the patient, they ask you how to walk with different patients. When the patient is blind, she's going to be right next to me, butt side to side, right? She's going to hold my elbow. No, can be elbow, my elbow, la, right there. So NCLEX asks you, hold elbow, hold arm, hold hand. You got to be careful. They say put it in order. This is a blind patient. She's always 1 foot behind me. I'm always ahead of her. One leg. Where's her leg? Should be behind. She's walking, but she's always 1 feet what? Behind. That's a blind patient. She holds the nurse at the elbow, side to side, and the nurse is 1 foot ahead, and she's 1 foot behind. That's blind patient. Any question? Now, NCLEX asks you question how to walk with a patient who just had surgery. She weak. Anytime a patient is weak, she just had surgery, so she don't have DVT, you want to walk her. So these patients, you're going to put a belt. So in her case, it's her bra, right? Now, these patients, the student always say, I'm strong. I hold on to you, right? Listen, you always tell these patients to walk with the legs a little spread apart, right? And she walk. Marche, mommy, marche. Now, qui en jambe li ouvert. If something happens, she become weak, she want to fall. You boop, boop, floor. Because you need to put a belt, because she was on medication, pain medication, and she's weak. So far, I taught you how to walk with a cane patient, how the patient walk with the cane, how you, the nurse, walk with a stroke patient, put in order, how the patient, you walk with a blind patient, and how to walk with a weak patient. Now, NCLEX asks you how to get a patient out of bed who have a stroke. Mami Shita. Now, so we're going to do, the bed is here. Okay, so we'll say, you the bed, you and Susan, right? The bed, right? 2 side rails up. This side rail, this, and the bed is here, right? It doesn't matter. You can put the chair, you can put the chair, it depends on, you can put the chair here, really close, or you can put the chair here, really close. Let me see, I want to put the chair here, very close to the bed. Now, the patient is in bed, right? Right? And we're going to bring the chair as closest to the bed as possible. Now, 2 side rails up, right? You're going to put 1 side rail down, right? So we're going to say, we're going to put this side rail down. So wherever the side rail, we're going to leave this side rail up, this side down. Wherever the side is down, that's where I'm going to stand, right here, right? So I first put this side rail down for safety, right? So she's fine. This side rail is up, still up. I'm going to tell her, Kawal, I want you to scoot all the way to that side rail. She gonna scoot all the way to the side rail. Now I'm going to move where the side rail was down to where the side rail is up.
So Miss Sonia, you have to put the chair on the stroke side?
Hold on, I'm going to show you. We're going to put where the side rail is up, right? Now the side rail is up, and I, the nurse, come here. She's still in bed laying down. All she did was move her butt all the way to the side rail. Now I'm there. I'm going to put this side rail down. I'm here, right? Now, if her head is here, I'm going to move the, parce que tête li là. I'm going to move the chair, right? Now, really close. Her stroke is, Shita Mami, so I can show you where the stroke is. Just example. Her stroke is this side. So that's the strong side. Wherever the strong side is, that's what she can do by herself, right? So we get Mommy, now Mommy get out of bed, right? Now, the chair is like on the side. Remember, this is the good leg, right? Mommy going, while I'm here, right? That's the good side, right? Now, I'm going to pull the chair close to Mommy. Then I'm going to ask Mommy to back up, because she only can move the good one. Back up. Mommy backing up. Back up. Mommy, you fine. Back up. Right? I'm moving this for her, but she moving the good one. Back up. Then I'm going to ask Mommy, do you feel the back of the chair? Mommy say yes. I'm going to say, Mom, in 1, 2, 3, the first thing I want you to put the stroke hand on the chair to hold it. The chair is locked. Back up all the way till you feel it. Mommy backing up. Then I'm going to say in 1, 2, 3, sit. Mommy going to go really quick. And Mommy is in the chair. The key, you need to use what Mommy has. And the only thing Mommy has is the stroke side, which is the stroke side. Any question? Thank you. Now, we going to stop right here in stroke and start delegation so I can keep the classes together. Okay?